Hello and welcome to the 2026 Premier Insurance Group Medicare Team Update for the upcoming year. I appreciate you clicking on this video and following along with us as we kind of give you an update on what things look like for the next year for everyone. So real quick, I'm going to introduce my team. My name is Larry and I started our agency back in 2017. This year, my son Kevin was licensed as an agent and joined me, along with his wife Shelley as our office manager. They have both been a great addition to my team, and I'm really excited to have them on board. All right, so the reason that you're viewing this video today is because you got some kind of notice about changes for your Medicare plan for next year. And some of these items that you received are tough news about your current plan. So the question is, how do we move forward from here? So for you, the client, there are going to be some plan exits. Regions Blue Shield of Idaho is leaving the state for their Medicare Advantage plans. Plan terminations from Blue Cross, UHC, Regions, Humana, and Pacific Source have caused a lot of people to need to seek a new plan for next year. You'll notice that the plans that will be available have increased premiums and out-of-pocket costs. The prescription drug deductibles are raised on most plans, and some plans actually have a medical deductible for the first time. In addition, a lot of plans now have reduced or eliminated benefits like over-the-counter products and comprehensive dental. Some plans are now requiring a referral from your primary care provider before you can see a specialist. Okay, so two numbers to consider, 9% and 90,000. What do these pertain to? Well, the 9% of all Medicare Advantage participants in the entire country will lose their plan this year. That's over 2 million people. 90,000 of those participants are right here in Idaho. So we will be busy helping folks find a new plan for this year. So what do we do? Well, I'm going to make some recommendations for you. Some of these recommendations may not be exactly what you're wanting to hear, but I like to call it ripping the Band-Aid off to give you the truth about what we're looking at for next year. Okay, so your first option would be to stay with a Medicare Advantage plan just like you're doing now. You might want to stay with a Medicare Advantage plan if you don't mind this annual volatility. You don't mind shopping for a new plan every year. Maybe you've got minimal health needs. Maybe you've got some budgetary concerns for premiums. Maybe HMO network restrictions are acceptable to you, and maybe getting referrals to see specialists may not bother you. So those are reasons you might stay with a Medicare Advantage plan. There are a few things to consider, though, when thinking about Medicare Advantage plans. These include provider networks, medical and drug costs, overall benefits, and unfortunately, potential future plan terminations down the road. For the Treasure Valley, where the bulk of our clients sit, we boiled it down to three options. Two plans from Blue Cross of Idaho, one from Pacific Source, and two from St. Alphonsus. In the Twin Falls area, Blue Cross of Idaho and Pacific Source, and in northern Idaho, Blue Cross and Pacific Source. You'll notice the top bar section. It says, keep in mind, there's always a risk your provider leaving the Medicare Advantage plan network mid-year. To give you an example, last year, Humana lost their contract with St. Alphonsus Hospital System, and next year, they will be losing St. Luke's as part of their hospital system. So we're not discussing Humana plans at all because I'm not sure which hospitals they'll have in network next year. All the plans we're talking about today have a fitness club benefit, hearing benefits, preventive dental, and Part D prescription drug coverage. Most have a local provider network only, US-based customer service, which is good, healthy rewards for doing your wellness and preventive service, and also some discounts on your prescriptions through using a mail order pharmacy. Some plans will actually give you some of your Medicare Part B premium back in the form of what's called a cashback. Some have comprehensive dental built right in the plan. Some still have over-the-counter product benefits. Some of the carriers do offer a U.S. travel allowance. Like if you're traveling and you want to schedule a routine visit with a doctor, physical therapist, or chiropractor, you'd actually be able to do that. While we don't have a crystal ball or a time machine, fast forward to this time next year. Could we possibly be doing this again? I hope not, but unfortunately, it's possible. In our opinion, maybe the practice of chasing the best benefits every year may not be a great idea and might need to stop. Otherwise, we're left just like the young man playing whack-a-mole on the left. We might be chasing something every year and having to make a plan change every year. Okay, which carriers are we going to talk about? First, St. Alphonsus Medicare Advantage plans. All of their plans are zero premium with up to $1,225 cash back on selected plans, flexible benefit cards for hearing and vision, no deductible on medical services, and discounts on some of their medication. They offer an embedded preventive and comprehensive dental benefit with a couple of rider options that can be added, a fitness club benefit, as well as vision and hearing. It's a local company that is very efficient in the way they operate and pay claims. We think St. Alphonsus offers some really competitive and attractive plans for next year. Blue Cross of Idaho, who a lot of you folks are already on, will have two plans in many areas, with some areas only having one plan. I will say this, they are the largest carrier in the state. As far as footprint, you'll notice that they are in just about every corner of the state. Their premiums are going to range from $16 to $153, so gone are the days of zero premiums. They only have preventive dental, but you can buy a rider on all plans for an extra $26. You still have the vision and hearing aid and fitness club benefits. And again, you'll have the largest statewide network. There are a couple of changes, though, as far as how you can use the plan. It now has a medical deductible on outpatient services at both hospital and ambulatory surgical centers. And if those outpatient services are done in the orthopedic realm, you're now looking at a potential 20% coinsurance on top of that deductible, which could make an orthopedic outpatient surgery very expensive. And one last thing they changed about their plans is that all plans will now require a referral to go see specialists. So a little more complicated to use Blue Cross plans going forward. Last but not least is Pacific Source, a really great local company based out of the Oregon area. They have a couple of plans that actually might be competitive to look at. One thing that's nice about Pacific Source is they don't use any kind of foreign or overseas call centers. If you call Pacific Source, you're going to get a live person on the phone every time. One concern we have about Pacific Source, maybe though, is stability over the long haul. If there is a plan that might potentially go away next year, it could be Pacific Source. So let's keep that in mind. They have plans varying from $15 to $57, no medical deductible, no referrals required on their plans. These plans are going to be basically focused in southern Idaho for St. Luke's system. Up north, there's a different list of providers. It's one of the few that still have comprehensive dental. Also, there's the annual vision benefit for eye exam and glasses, fitness club benefit, as well as hearing tests and hearing aids. They also have alternative care such as non-Medicare covered acupuncture and chiropractic. And it still has a small quarterly over-the-counter product benefit. So Pacific Source might be competitive, and we'll look at them as an option for you. So those are the Medicare Advantage options. What is the other option you have? Well, because you're losing your plan, you might want to consider going back to traditional or original Medicare, adding a Medicare supplement, which we'll call a Medigap, and a standalone prescription drug plan to help with your drug costs. Reasons why you might consider this is maybe you've got more health concerns now, or maybe you're worried about more health concerns in the future. This could potentially give you a much lower total cost of care because the coverage is at a higher level than with a Medicare Advantage plan. This may be the time for you to consider a Medigap option. And here's the great news. If you're losing your Medicare Advantage plan because it's being terminated, you have what's called guaranteed issue or guaranteed acceptance on a Medicare supplement plan, meaning no medical underwriting will be allowed. It will be guaranteed for you. So the way these plans work is Medicare, original Medicare, the red, white, and blue card, will be paying the bulk of your charges. The Medicare supplement plan will be there as a secondary insurance, helping with what's left. The Medicare supplement plan will be there as a secondary insurance, helping with what's left. We'll get to what those plans pay in just a moment, but just know that Medicare pays first, then the Medicare supplement plan. A nice thing about this approach is that there's no networks anymore. There's no HMO or PPO network. It's any Medicare provider that's taking new patients around the country. You'll never need a referral. It's got limited prior authorizations for services and minimal to no paperwork. The plans are also standardized, meaning carrier A and carrier B are going to be exactly the same for the most part. What you might see is a little variation where a carrier might throw in a gym benefit or something like that. But for the most part, as far as the way it covers your medical expenses, they're all standardized. What's nice also is if you decide to move to a different county or a different state, you take the policy with you. You don't need to make a change to that policy if you move. And they're also guaranteed renewable, which means as long as you pay your premium, you can keep that insurance. So what are the three Medigap options that we like and how do they work? Well, we like plans GN and high deductible G. The way these plans work is after Medicare pays, Plan G is going to pick up everything except a very small annual deductible. Next year, I think it's going to be about $288, so it's nearly 100% coverage. This is your number one best-selling plan in America. This is your Cadillac or Mercedes of plans. The next option is Plan N. After Medicare pays, it also has a $288 deductible that you'd be responsible for, then 100% coverage for services for the remainder of the year, with the exception of three things. There is a $20 office visit copay for primary care and specialty, $50 emergency room copay, or if you have a doctor that does not accept Medicare's assignment, they can charge 15% excess charge, but this is very rare. The last option that someone might want to consider is a high deductible G, which is a little bit lower monthly premium. The way this plan works is Medicare would pay a portion, then you would have an annual deductible that you'd be responsible for up to $2,870. If and when you did that, it will function just like a G. You'll have 100% coverage. So it could be a much higher level of coverage than what you're used to with a Medicare Advantage plan. So which carriers should we like? We have about 5, and we like each one for a different reason. They are Moda Health of Oregon, Blue Cross of Idaho, AARP United Healthcare, Aetna, and Regence Blue Shield of Idaho. Some offer a household discount and some offer a fitness benefit. Also, the monthly rates for these plans can change each year. Okay, so if you go the route of traditional Medicare with a Medigap, you're also most likely going to want a Part D plan or prescription drug plan, a PDP. The monthly costs for these plans vary depending on which drugs are being covered. Medicare.gov is a great resource to find the best plan. Almost all carriers have stopped compensating agents on these plans. We will do our best to help you find a good PDP. However, you may need to do some of the research for yourself. We've created a PDF document as a guide on how to go onto Medicare.gov as a resource. I'd recommend you wait until after October 15th, and we'll show you how to run your own prescription drug comparison, and you can enroll in the plan that comes up best for you right there. If you want some assistance, the state does offer Sheba, a free service at 1-800-247-4422, Monday through Friday, 8 to 5. You can also go online and schedule an appointment for a call. So in conclusion, we've really got two options. Option one is to stay with Medicare Advantage plan. Again, some of the pros were lower monthly premiums, some of those extra benefits, Part D coverage is included. It's what you're used to having. The biggest cons would be potential higher cost of care if you have a lot of medical issues now or in the future. If we have continued market or carrier volatility, we might be doing this again next year. Also, if your provider leaves your network that does not allow you to make a plan change, you most likely would have to pay either out of pocket to see that doctor or get a new provider. The section option was again traditional Medicare plus a Medigap policy plus a Part D plan. And like I mentioned, if you're losing your plan, you have a guaranteed issue right or guaranteed acceptance into a Medigap policy. The pros are lower potential total cost of care. If you have high medical needs now or in the future, or you have a catastrophic health year, you'll have access to any Medicare provider anywhere in the country. It's a simpler billing and payment model for your doctors. You'll also avoid this annual Medicare plan volatility and constant churning of plans, the roller coaster of Medicare Advantage. The cons would be that this is going to be a higher monthly premium than maybe some of the other options under Medicare Advantage. Also, fewer extra benefits. There's no comprehensive dental or vision or hearing, and the annual rate increases slowly make the product potentially more expensive over time with premiums. You can also go from a Medigap back to a Medicare Advantage with no medical underwriting, so you're not stuck with a Medigap policy. If 2 or 3 years down the road you decide, hey, the Medicare Advantage market looks a little more stable, it's easy to move back. Thank you so much for taking the time to watch. I would recommend maybe you watch this a couple of times and then get back in touch with us. We look forward to assisting you moving forward in 2026. Thank you for your loyalty and thank you for your cooperation and teamwork. We really appreciate you and we look forward to working with you soon. Thank you so much.